Bhagwan Ram says, I said says, which means I'm talking there? Present. He says, because he exists for all of us, he says that when you have a nirmal man, when you have a pure mind, when your soul is pure, when you have no negative thoughts, you will find an energy bubbling in you that no electricity house can give. We must have, he is saying, we must have pure thoughts. So many of us, all of us, from time to time, impure thoughts come into our hearts. They will come. They will come. But because of your sadhana, because of your association with the nama or the name of the Lord, you will tell the impure thoughts, you know what? You come. Just as how you came, so you must go. Only pure thoughts can make us normal and good human beings. So I leave you with 3 H's. In this world, when pure thoughts come to us, we must have a head to think. We must have a heart to feel. And we must have hands to work. Head to think, meaning that you must not only think and stop there. Many people, they'll say, they'll tell us, Swamiji, for example, Swamiji, you see that project? I thought of it and I told this guy. So the Swamiji said, what happened to you? I know this guy is so successful and you are still begging in the streets. What happened to you? He said, well, I only thought. You can't think only, but you must think. But when you think, it must be associated with feeling. And when thinking is associated with feeling, and you start to think negatively, then the negative feelings will come into you. Depression will come into you. And when depression comes into you, you look for other sources of help. When you are in the youths of today, some of them do not get depressed, but most of them, when they go to the depressive state, what they do? What they do? Smoke what? Weed. They smoke LSD. Unfortunately, what the LSD does, or the weed, or marijuana, cocaine, whatever, it alters the chemical, the biochemistry in our body, and we float. So the fellow says, Swami, why don't you speak to the government to legalize marijuana or weed? He says, no problem. Answer me this question. If a pilot comes to you and he's smoking, would you want to go and sit in that plane? He's already flying. He's already flying. He hasn't gone in the plane yet, and he's flying. Would you like a surgeon who is totally stoned to come and operate on you? No. You would not want that. So why would you want this for yourself? God has given us a factory within. This factory has so many things that we can utilize it and we can be stoned forever. You hear me? We can be stoned forever without taking any drugs. Our young children should know this. You ought to be stoned, be in a group, do group meditation, group yoga. Our young brothers and sisters, group meditation, group yoga. That feeling of exhilaration that you will feel, no drug can make you feel like that. So you have a head to think, you have a heart to feel, and you have hands to work. And when you develop that purity of mind, when Swami Vivekananda was in Chicago in 1893, he was 30 years old. He was from Bengal. English was not his first language. He delivered such a speech. Everyone wanted to touch the hem of his dress. And then they asked him, when he came back, one of his brothers asked him, Swamiji, how come you could give such a powerful address and even not in your own language? He says, because when I was 16 years old, from 16 years old to 30 years old, I never thought of one impure thought. I'm only telling you this so that you can understand the power of the purity of thoughts. We can't come and do all the abhishek, etc., and our thoughts are how we can destroy this other fellow. Or how can we show him up? How can we like him to trip up so we can laugh at him? Is that right? We cannot do that. I am speaking to people who come to temple and mosque and gurdwara, like myself and all of us. I'm not excluding myself here. All of us. We only have these thoughts. And you know, when these thoughts come to you, you see the person fall, you laugh, but your consciousness will tell you, you should not have done that. And that consciousness is your pure Atma. When we use our toothbrush, you give anyone else to use it? When you toothbrush, morning when you use it. What do people use? Other people toothbrush, but generally speaking, people use, Rajiv, what do you think? Your toothbrush. Anyway, let's just get into the details. So, you only use your own toothbrush. Baat sach hai, Prashasta? When we use our toothbrush, we keep it for ourselves. No one can use our toothbrush. We don't want to use anyone's toothbrush. Why then do we want other people to inflict different thoughts upon our mind to prevent the purity of our minds? Let us keep our mind like a toothbrush. We use it for ourselves. You don't let it go to others. Never say mean words out of anger. Anger will pass. This is when you use your toothbrush and you give others to use it. Never say mean words out of anger. Have that pure mind. Have that steady mind. Anger will pass, but your mean words can scar a person for life. So use kind words or be silent. So many times we use mean words on our children. So many times we use mean words on our friends. Let us try to keep our mind pure. Let us keep that purity with us so, obstacles you'll meet in life. I'm not saying you will not get obstacles. Obstacles will come. But what you be like? You be like the Ganga The Ganga starts from the Himalayas. It comes down. Don't you think it reaches obstacles? You go. You go to Rishikesh, you go to wherever. You can't go to Banaras and see it. You have to go to Rishikesh side to see the rocks in the river, in the Ganges. And when the Ganges meet the rock, it does not allow the rock to stop it from going in its direction. It has its focus. In this life, you must learn to focus. Ganga Ji focuses. This rock will not stop me from going. So what she does? She moves to the side. If the mountain comes to her path, that will not stop her. She'll go along the bottom of the mountain. If she has to go all the way around the mountain and then come back, she goes back into her direction. Let us learn from the river Ganga that we must not let anything be an obstacle in our pathway. And I'm telling you, in the pathway to spirituality, in your own house you'll have obstacle. If you don't believe me, you mark it and you'll see. If there don't be an obstacle with their words, they'll have that obstacle in their minds. And you'll see from the action, the obstinateness of these people. Spirituality in this world today, although you want to go the path, there's so many people who want to pull you away from the path, drag you away from the path. And this is why we must try to grow spiritually. That which does not change does not grow. There's a story with a crow. It'll teach us a few things. The crow saw a jug of water, and his beak, the water was at the bottom of the jug, so he could not get the water. Kakacheshta bako dhyana shvada didya tathaivacha alpahare grihatyage vidyarthi palchalakshara. Vidyarthi means student. We are all what?
Students.
We are all students. All of us are students. We are students until the last day we breathe out, we are students. Don't think the children in school are students. So we must learn. Kakacheshta bako dhyana swara didya tathaivacha alpahare grihatyage vidyarthi palchalakshara. The crow, he put all this effort. We must try to put all our, what he did, he threw stone in the water. Stone by stone, and the water came up. So, how does this translate in our lives? It translates in our life that we must not let anything that look impossible to us and we back out. Tackle anything that is impossible, and you will see the effect. Bako dhyana. Bako, crane. You know the crane? By the sea, you all have seen the crane. Standing up on one leg. But where is his focus? Focus is on the fish. But listen to this. The small fishes are there, but you don't want the small fish. He waits and waits because he knows the big fish will come. So when the big fish comes, then he goes to the big fish. The small fish are the pests in our life. Pests, P-E-S-T-S, pests. The pests in our life, who are going to dip our toes, talk to us about you. Don't bother them. Keep your focus. Keep your focus on what you want. You want spirituality, you want purity of thoughts, you want purity of mind, keep your focus. Shwara Nidra. Although the dog is sleeping, as soon as a song change, the dog wakes up. Alert. We must be that alert. Time is going, so Alpahari, we must feed the right, we must have the right food. We must have less food, but what we must have, not the food in our stomach only, but the food for eyes, the food for ears, the food for nose, the food for minds. We must, you know what you call it? You have a sieve home? How you put things on a sieve and let the useless thing drain out? Let the useless thing drain out in the sieve. Grihatyagi, come out of your comfort zone. You are not going to achieve anything if you're in your comfort. If you're going to lie down and read over there, and you read, it's not going to work. You have to sit erect, read. I don't after every 5 minutes, like some of us, as soon as you read for 5 minutes, you go and get some munchies and you come back. Then you read for another 5 minutes, you go for some more munchies and you come back. You use the reading as an excuse to go for the munchies. So that is how we have to live in this world. That let anger take the best of us. So I will talk about stroke a little bit. Last week I spoke about stroke, and I told you there are 3 types of stroke. There's one stroke which is called ischemic stroke. I want to remind you about it again. Ischemic stroke is when something goes from your neck and go into your brain or from your heart. 75% of strokes are that way, ischemic. And with ischemic stroke, if you go to emergency, some emergency, they will give you something and they will melt that clot. Don't worry about names and so forth. It will melt that clot. And if you go to a sophisticated institution, and there are only very few in Toronto, in this area, who can do it, like Toronto Western, Toronto General, St. Michael's, and Sunnybrook. The other hospitals can't do this, what I'm going to tell you. What they do, and this is important for you all to know, that should any family of yours get a stroke, don't waste time and go, well, you got to call an ambulance, unfortunately. And the ambulance will take you to the nearest hospital. That's the rule here. So what they do in the hospital, they will do CAT scan, they will do this. Then that hospital will have to transfer you to another hospital if this procedure is necessary. So what they can do if you go to any of these hospitals that I mentioned just now, like TGH, Western, St. Mike's, or Sunnybrook, they'll do a CAT scan. They will see whether you have an ischemic stroke, meaning a stroke, but there's no hemorrhage in your brain, which they can see immediately with a CAT scan. Because if you have a hemorrhage, then that's a 25%. You can't do anything about that. You got to stop the bleeding. Let's talk about this, what you can do something about. Then they will go with a wire through your leg, go up into your head. With a small thing, they will retrieve that clot. And you get cured immediately. Immediately. And they're getting... We used to do, when we started first, 25% success we had. But now the success rate is much, 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 much higher. So, if you see any of the signs, try to see whether a family of yours can put you, if it's possible, to take you to one of these hospitals that can do this thing for you. Then you don't waste too much time. So they can take it out. After the stroke, they will put you on things that they call an antiplatelet drug. Antiplatelet drug, the ones that you all know about is what? Aspirin. Aspirin is an antiplatelet drug. Everyone over 60 should be taking aspirin. Small, baby. The aspirin will prevent clotting. So these drugs are much more powerful than aspirins. This is all I want you all to do. They are going to put you on drugs which are much more powerful than aspirin. No point in telling you the name of the drugs because you are not going to remember. It will be of no use to you. And then they'll keep you on that drug for so many months, and then they'll do so. Now, if you get a stroke, and the third stroke is TIA, transient ischemic attack. TIA, transient ischemic attack, which occurs, which gets better within 5 minutes, or it gets better within an hour, but it gets better before 24 hours. That is transient ischemic attack. A small clot goes up there, and it causes a blockage, and the body's own blood melts clot out. The clot can go into your eye. I mentioned that to you all last year. I want to mention it again. You can go to what they call the central retinal artery, and then you lose your vision for half an hour, 2 hours, and your vision will come back. If that happens to you, loss of vision, completely loss of vision, and it comes back, you must know you had a stroke in your eye. You should go and see a doctor. I told you they will check your neck to see whether you have plaques and tell you what you should do, either stent or surgery. Now, when you have a stroke, what do? You have to have rehabilitation will help individuals with stroke. Lots of help you get with rehabilitation. They help overcome difficulties that result from the stroke damage. They exercise your hand. Some people go for speech therapy if their speech is affected. As you know, the way to know if the patient has a stroke, he loses his speech or his speech is garbled, or first thing you ask him, what's your name? And they don't remember their name, you know they are having a stroke. So after the stroke, you get that. Next slide. A drug therapy, as I mentioned to you, with blood thinners, the most common treatment for stroke. So stroke, although it can be terrible and can cause death, as you know, it depends. We must try to get down. If we are diabetics, we must try to get down our insulin that low that we do not use insulin. Let our body use its own insulin. That is one of the big things that what we call insulin resistance does. It causes stroke, it causes heart attacks, I told you this before, I'm reminding you again. I know that. And one way for us to keep healthy, if it's possible, is to exercise, not to eat sweets. Sweets are not good. You know what loves sweets? I told you this before. What loves sweets?
Cancer.
Cancer. People who have cancer should never have sweets. Never. So sweets you should not take. Exercise is most important. And try intermittent fasting. Intermittent fasting will use up the insulin in your body. If you have lots of insulin that is not being used, it will use it up. It will convert excess fat into sugars. It removes the fat cells from your body, convert it into sugar. It's called lipogenesis. And the intermittent fasting, don't go rush on it. Go for 12 hours, then go for 14 hours, then go for 16 hours, and then go for 18 hours if you can. One important, people tell me, Dr. Doobay, I do intermittent fasting, but I do not lose weight. Many ladies say, oh, because I'm menopausal. Well, the menopausal weight comes from the plate. That's where it comes from, the plate. P-L-A-T-E? From the plate. So when you finish the fasting, you can't go dump a whole load of carbohydrates in your body. You eat leafy green vegetables, you eat nuts, you eat cheese. Those who are not vegetarians can eat other things. Vegetarians are the most difficult. Vegetarians are the most difficult when it comes for getting calories. And just not eating salad all the time. But for non-vegetarians, it's not that difficult. I'm not advocating that you should be a non-vegetarian, but I'm only telling you, if this is the style you adopt, then this is one way you can go. So, intermittent fasting, please remember, go slowly with it. And the whole purpose of intermittent fasting is to burn the excess insulin, burn the excess fat to prevent things like stroke, heart attacks, and so forth. Another thing intermittent fasting does, it increases our immunity. In this COVID situation, intermittent fasting increases our immunity. For those of us who had our first vaccine, and we are still waiting for a second vaccine, I don't think you're waiting too long. A study has shown, I told you this last week, and I want to remind you again, a study has shown that the longer you wait with your first vaccine, you develop much more antibodies. So when you get a second vaccine, you get a better boost. So once you get a vaccine, any vaccine, I know there's a lot of bad name with AstraZeneca, but it's 1 in a million. 1 in a million that gets problems. But Pfizer, everybody wants Pfizer or Moderna. But get your vaccination. But when you get the vaccination, please don't let your guard down. Wear your mask. You don't want to introduce the virus into yourself. Neither, when you get a vaccine, you can get COVID, but you don't get sick, but you can be a what? Carrier. Therefore, that's why mask is important. Until we get herd immunity.